Hello, everybody. Tanche, Tawau. For those who are new here today, welcome. And for our old friends who are joining us again, welcome back. We have Carly. Hello, my name is Carly. I am from Thunder Bay. I'm getting a little confused here. I'm so sorry, everybody.
That's okay.
We have Alexa, we have Carly, we have Kate here today. And what I'm going to do really quickly is I'm just going to pass it over to Kate, and she's going to open us up in a good way. I want to also just really quickly thank Alexa for once again joining us and leading us in this really important discussion that we're going to have today. But without further ado, I'll pass it over to Kate, and then we'll get started.
So I am just gonna start us off in a good way with a smudge. And I'm gonna drift it your way with the intention of it reaching everybody that's joining us today. Just asking the Creator if there is anything that is weighing on your heart or your mind, that we are able to let it go. That our ears are able to listen to what Dr. Alexa is going to teach us today. That our hearts are strong and our mouths speak kind words to each other. I just want to take a moment to thank the Creator for Mother Earth and all of our relations. I'm not sure where everybody is from, but here in Thunder Bay, we've been getting a pretty good amount of rain. And I just thank the Creator for that, knowing that Mother Earth and all of our relations rely on that water to give us nutrients and life. So I just want to take a moment to say Chi-miigwech to the Creator for that, as well as all the gifts that we have been given, and as well as for this time to learn from Dr. Alexa. Miigwech.
Yeah.
Thank you.
I really did need that smudge. Before we start, again, I just wanted to say welcome to everybody. And for those that are new, joining us today for our Women's Health Talk, I just wanted to touch on, it might be new for you to see that you're not able to turn your camera or your microphone on. And I just wanted to address that and let everybody know that it's really important for us to ensure that we have the safest space here possible for everybody who joins us. And so for that reason, that's why the cameras and the microphones are turned off. And if there is things though that you wanted to say, if you wanted to ask anybody questions, there is a way that we can still hear you. And so by using that chat box today, Kate or I, and also our coworkers who are in the background, we can receive all those questions, all those messages, and we can pass them on to Dr. Alexa. So one of our main goals today too, along with having this information, sharing this knowledge with you, is to ensure that your questions are answered and that your comments are heard. So please feel free to ask as many questions as you like and share any information with us, and we will make sure that that information is passed on to Dr. Alexa. We also we usually have a break midway through every Women's Health Talk that we have. So we will have maybe a 5 or 10 minute break in about an hour's time. And later on in today's event, we will start posting our survey. And we really, really appreciate everyone in the past who's provided us with that feedback, those requests for future events. We are setting up all the rest of the year's Women's Health Talks, and we look at every comment and every request that's sent in to us. So Chimigwich to all of you out there for providing us with that feedback, and we look forward to reading those surveys that we'll receive today. We do have a gift that a draw gift for all the surveys that we received today. We'll draw for one gift. We're still, that's to be announced what the gift is right now, but I just wanted to also touch base, add that information and just let everybody know that there again will be a survey towards the later half of our event today. And thank you again, everybody, for joining us. So I will pass over the microphone to Alexa, and I'm just going to mute. There just might be a couple seconds here where we adjust all our volumes and everything like that. Okay, thank you so much.
Okay, awesome. Thank you so much, everyone. Chimigwech. I'm going to get my slides up in a second, but also just first wanted to introduce myself. So, Buju, Masabe Kwe, Indigenous Cause, Mekwendo Dem, Visionwa Big Sogging, Anishinaabe and Donji, Noktumingwaning Donji, Anishinaabe Kwe and Dao. So my name is Alexa Lesperance. I'm a family doctor. I'm in my second year of practice. I'm from the Bear Clan, which is very important, or I think significant to my journey within medicine, being that a lot of Bear Clan people generally are medicine people. My spirit name, Masabekwe, translates to Sasquatch woman, and Sasquatch Sabe is the protector of all of the medicines within the forest and all of the creatures that live there. So that's me. That's who I am. I'm very easygoing. So the whole point of these talks and why they were started is because we wanted to be able to give information to people in a real way, like that you would actually understand and that I would understand and that you would understand. And so a lot of this is sort of bi-directional. So if you have questions or comments, I read them out and I answer most questions, mostly just because I want this to be helpful to you. Think of it as like 2 hour access to my brain as a doctor who is also an Anishinaabe person. So just fire away. But we'll be going over stuff. Today's talk is actually about vaccines and our medicine chest. So yeah, I'm just gonna share my screen. Advanced portion of the screen, share, perfecto. Oops. I'm gonna do presenter view here. Awesome, so we can see that. Right, okay. So already introduced myself, but this is what medicine means to me. So the journey to becoming a family doctor was actually quite difficult and quite harrowing. There are a lot of times that I wanted to quit because, as you all know and probably experience, medicine is like there is inherent racism and systemic racism. And so I experienced that going through medical school and becoming a physician. Thankfully, once I got to my residency program, which I did out on the West Coast in Vancouver, it was actually an Indigenous family medicine program. I was finally able to train with other Native doctors, and that actually helped. That helped me immensely to be able to learn from all of the people in medicine that come before me. I say that I became a family doctor because I didn't have the spiritual gifts to become a traditional medicine person. That's what I would have liked to have done. That's what my lineage and my grandparents, my Mishomis, my papa, that's what he is as a traditional medicine person. And so I grew up around our lodges. And I also grew up with a set of grandparents that knew a lot about the land and when to harvest, when to go look for blueberries, just very, very knowledgeable. And I a lot of my siblings have a lot of really awesome spiritual gifts. It's just not mine, and that's okay. So the second best that I could do was just becoming a Western doctor, a family doctor. And I want to acknowledge all of the traditional medicine people because of how long, like the learning and the journey that is required of that is actually the same length of medical school. And so our people should be paid the same amount as physicians. In the photos here on the left-hand side, this is myself. So this was after 4 years. I did a traditional medicine camp, learning very minimal, the basics of over the 4 years, 42 different medicines, how to find them, how to make offerings for them, how to harvest, how to use. And so I'm nowhere near being an expert on any of those medicines. But it is my goal to eventually have medicines that I can lean on as comfortably as I do antihypertensives for hypertension or like diabetes, your metformin. So I would like to become as knowledgeable as I am in a Western way. And so this was me actually receiving from one of my teachers, Laura Horton, an Eagle fan to commemorate all of the work that we had done over the 4 years. I started that process when I was in medical school. And then, yeah, the other photos I just think are a mix of things that are important to me. So I saw our people and myself, I saw our people being harmed by medicine. And so that's what drew me to doing this, is being able to try and navigate both of those worlds so that we can have better care. And I think we need more of those folks. So those are just pictures of me casting. I think one of those photos is me looking for spruce gum or trying to get some bark off. Some pictures of me in the clinic. So it's a combination. It's really important to me to have both of those worldviews, and I don't know how well I do them, but they're important to me nonetheless. So, um, so today's talk is about vaccines, measles illness, what's in our medicine chest. And so I want to start by acknowledging the fact that Indigenous people, our people in Canada, are impacted by higher rates of poor health. And I would say, like, largely related to racism and the ongoing practices of colonization or colonialism. We see modern day examples of this all the time in the news, in the paper. You hear about it on Facebook, you hear it from your friends. So, this is an example of harm that in present day continues to happen. And so this was actually in regards to Brian Sinclair. So he was a 45-year-old male who had gone to the Health Sciences Center emergency department in Winnipeg, Manitoba. And he, presented looking a little dazed. His clothes were sort of unkept. And so there was this assumption that he was drunk. And he was sleeping it off. So he was there in the emergency department. He sat there for about 34 hours before someone actually came to come and chat with him and discuss his care. And so this is an inquest actually went into this because in Brian's case, it was being ignored to death, really. Um, and there is a lot of struggle within medicine. Being seen in a timely manner is difficult, like across the board. Emergency wait times suck. Waiting for your imaging, waiting to see your specialist, like we're just so backlogged. Um, but there is within medicine an implicit bias to deprioritize Native people when they arrive in the emergency department. So what that means is implicit is where you make assumptions about something before the person's even entered the room. Like if I were to give you a description of something and you'd all automatically have feelings or thoughts about that you're not actively thinking, they're in the unconscious mind. That is an issue. And so in Brian's case, he actually had pyelonephritis. So my understanding, so he had a bladder infection that I think ended up making him septic, and so that's why he was dazed and confused. Whereas you can see the implicit bias was that when the emergency department had seen this man arrive, figured, oh, that must be what that is, right? There was that automatic thought process and jump to, oh, he's just sleeping it off. He has nowhere to go. It's fine. But this is the case where we can't have premature closure, which is where something that people in healthcare can fall into, which is where you see a symptom, like a single symptom, or just like, and then you jump immediately to what you think it is. Versus there's a lot of reasons that people come to the emergency department and they are like not like as conscious as we want them to be, or they seem confused, right? There's more medical reasons that people can be that way that aren't drinking. But it was because he was Native that assumption had been made. So unfortunately, in Brian's case, he ended up passing away. And I think the final report, because they had an autopsy, that's where they take the body and examine the internal workings to see, like what was the cause of death. And it was not considered a homicide, despite our lack of care that resulted in his death. And so there's still actually active inquiry about this case. And why I talk about this isn't to make us feel sad. I feel awful hearing and seeing these things because I react very viscerally to those things because that's our reality, right? Like that hurts me to know that this person, who was likely someone's parent, uncle, our relative, was sitting there and didn't receive care. And so I try and give my colleagues, people within medicine, the benefit of the doubt. Things are shifting, but we do need to do better. I sometimes jokingly, but not jokingly, will say, because when people die, there's usually a death certificate that comes along with it. And so you usually write what you think was the cause of death, right? There's like a primary diagnosis, the main thing you thought it was, secondary, which is like, oh, it was probably impacted because they were also on dialysis or they had heart problems, all of these things. So there's just a death certificate. And there have been so many times where I wanted to write the cause of death or illness was colonization as the primary diagnosis. And I think that's true of a lot of illnesses that our people experience higher disparities in. So like Native people having diabetes, heart disease, all of these things have colonial roots. And unfortunately, we live in a society that does have illness and disease. It occurred and could occurred and will continue to. And so I think it's important to think about how our ancestors might have navigated this in the past, which is needing to adapt to our environments and the inevitability of change and needing to change and adapt because we're stuck in this together, whether we want to or not. Canada is Canada, so we're here. So this is often what I will see in terms of timelines, because a lot of what I do in medicine is actually rebuilding trust. in a system where I also don't feel a lot of trust and trying to make it better. So an example of like to illustrate the reasons why, because we're going to be talking about vaccines, which it's hard for people, some people, to get on board with, and there's good reason for that. But just, in this sort of simple example, the stress of colonization, the stress of displacement, residential schools, and what that led to, which was the perspective from people who were colonizing Canada, that Native people were second-class citizens. So when you have that thought process, when you think of a human as less than you, it allows your brain to jump to this dehumanizing sort of perspective, which then allows for people to be okay with things like starvation experiments, which occurred in residential schools, or to do really, really awful things. And the only way that that's possible is when we dehumanize someone. And so I think that's really a big reason why in our, at least in our Indigenous teachings, in Anishinaabe teachings, how we're all connected, and that none of us is better, all of creation. So not just humans, but all of creation is of equal value. And so you can see thinking of people as less than, it directly opposes how we understand the world. And so what this can lead to, because of this history, this timeline, this path, is patients have said to me, very ill, they say, I'd rather die than go to the hospital. And when that happens, well, one, it's devastating, and I don't blame them. So there's sometimes what can happen because experiences are continuously poor. I'm not saying all of them, but a lot of them are. You'd be hard pressed to find a Native person that hasn't experienced some form of discrimination within healthcare. People can sometimes embody this belief that nothing is safe. I can't trust institutions because look at all of these institutions that came before and what they continue to do. So why I think this makes sense is that there will be mistrust regarding Western medical practice, research, and medicine because we continue to experience harm. Some of those examples include coerced sterilization and abortions of women who were deemed mentally unfit. So that's where there was the assumption it was often Native women who had had many children, and they, unbeknownst to them, had their womb or their uterus removed so that they could not have any more children, and there was no consent. I think of even like in like there are people alive who have been affected by coerced sterilization, as well as the Indian hospitals, right? So those were like segregated hospitals. Often they were just like the TB hospitals, where that's where our people had to go. And even in regards to vaccines, there in the 1930s, 1940s, how we actually came up with the TB vaccine, which is still around worldwide, like it's used, like people get the TB vaccines often when you see those like really wicked like divots in people's arms, that's usually from what it was. But they're in order to get information and in order to like prove that that vaccine was safe, who it was tested on, one of the populations was First Nation infants for that particular vaccine. Despite it already being apparent, like they had already proven that if you change people's housing conditions, you change their living conditions, the rates of TB go down. So that's not a vaccine, but they had already proven this sort of, they knew that. And so, but they still continue to do trials, to continue to test the TB vaccine, which is devastating because when you know a solution to something, the right thing to do is to address those things, right? To say, oh, you know what? Great. Look at this. Like we actually have a community that's experiencing a lot of tuberculosis, TB. It's a disease that affects your lungs. Actually, it affects all of your body, but especially your lungs. And it's really easily contagious. Like it comes through the air and stuff like that. They had already known, like that's what you need to do. And they didn't do it, and instead continued to practice their vaccines, and to optimize it for the rest of the country and the rest of the world using our people, using our Abenogi or our babies. Um, yeah, and it's really quite depressing. And and I don't mean to make us depressed. And probably a lot of people know and they feel this history. Like you feel it in your DNA. Like when you hear these things, you're like, yeah, I know exactly what that was, or I can feel in my DNA the harm that has come from that. But why I like kind of really almost harp at the beginning as to how much mistrust there is that I understand that there is going to be hesitation with any intervention that comes from Western medicine. And there are people within medicine, there are Indigenous people within medicine, allies within medicine who want to make this process better, who want to do better. And so I do not judge people one way or the other. The goal of today isn't to like shove down your throat that like you need to be vaccinated or else, right? That's really not the purpose of today. It's really to give you information so that you can make informed choices. So there is harm, but I want you to know what happens if you don't get a vaccine. What happens if you do get a vaccine? Why do we need to get them? All of these information, because there's also a lot of misinformation. Like there's a lot of fear. I think fear drives a lot of the messaging you receive about vaccines. Like we're more likely to listen to that one case of some extreme crazy thing that happened when 1 in 100,000 people experience that versus like all of the normal experiences people have with vaccines. So this is just to say that I want to give you the information. And I think a lot like where this comes from is a place of knowing that there is deep harm, that there is work to continue to be done. And that also, like our ancestors who had to adapt continuously, um, we do need some sort of, we do have to adapt whether we want to or not. Disease and illness will continue to happen. New diseases, for example, COVID, like those things and we just need to be prepared, and we need to be informed. So I actually think it's interesting because there was a thing once. It's well that currently still exists in Treaty Number 1, and it was called the Medicine Chest Clause. So on the left-hand side here, you can see there's kind of like the buffalo, the treaty right to health, the sacred obligation. So there was like a written treaty. There was also a verbal word, yes, I am agreeing to this. Of course, anything that's not written down inside and signed is considered, well, did we really sign that? But the people know that that's what they agreed to. And it was that our people, they requested that. So I think the wording was like provisions for the poor, unfortunate, blind, and the lame, not the words we would use, but that's back in the day, that we should have a free supply of medicines. And so all medicine chests, like it was literally a box, like a box that had everything that you would need to compound, measure, dispense, and give medicines. Like if you had an infection, to give penicillin, if you needed a vaccine, to get the vaccine. And it often accompanied like this medicine chest clause, not only provided those physical medicines, because people knew, right? Like our ancestors knew there's shady stuff going on here. You disease was intentionally introduced to our people as a form of genocide. So they knew that. Like they had the foresight to be like, whatever medicines you guys have for your diseases, that's for us too. Like and you have to sign for that's true, that you're going to continue, that we will have access to what you have access to, because otherwise we're in situations where our medicines weren't made to combat diseases that we have today. Thankfully a lot of them do, but a lot of them don't, because illness was introduced, right? So vaccines were actually a part of this clause. So our ancestors thought, yep, whatever they're getting, that's what we need to get too. And so there, we actually have a right to, and millions of people, all of us have the right to health. And that increasingly comes under threat. And so I think it's cool to know that like someone thought about that. They're like, yep, we really need to be prepared. Don't trust this. We really make sure we get what they get. Um, because otherwise we will die. Like our and we almost did, right? Like that's an active part of colonization is removal of people, and we did it. So I think vaccines, and to me, in that sense, are like a treaty right. It's a gift. It's something that our ancestors really thought of beforehand. So why would they? Why would we like decline something that our people, like people much older than us, thought about this? I didn't think of this. This is an excellent clause. I didn't think of it. Um, so um, self-determination. So self-determination, that's like a fancy way of saying that you have the right to choose whatever the heck you want. That's true in all of medicine. There's only like a couple instances where like there's legal things that would need to be enforced if there was like harm to yourself or harm to others or something like that. But everything within medicine is a choice. It's a health decision that you get to make. So even though someone might say, oh, you have to do this, or you better do this. If you don't do this, then this is like, that sort of coercing. Nothing in med, you don't have to do it. Like, there's things where I'm like, I would prefer if you did that. It's going to really help your cancer. Please do it. But if you don't, that's your right, 100% to say yes and no and to decide what goes in and out of your body. But I want us to be informed and not like responding to things out of fear or because we saw like a random Facebook page. I myself like have studied, well, it took me 10 years to become a family physician and then practicing for two. So that's 12 years. Hopefully have some knowledge around this thing. And so that's even thinking about like when you get information and you see it online, it's good to think about like what are these people's credentials? What studies are they looking at? What like who is there, is someone benefiting from this information? I'll tell you right now, in terms of like measles and the things we're talking about today, I don't get any money from the drug companies. I think it would be kind of nice if I did because like they underpay family doctors, honestly. So, but that's not me. So everything you're hearing is like recommendations that are free from bias due to like industry or big pharma. I'm not getting paid. And so so the information hopefully is bias free. So why this actually changed? Because we were supposed to have a different topic for the Indigenous Women's Health Talk. But why it got switched to like actually just talking about this is because measles, which is a virus, the cases are rising. And so there was actually a warning, and there's actually weekly surveillance in Canada about that came from our public health officer that measles rates are rising. And it is due, the majority of those cases are people who are unvaccinated, which is kind of crappy to think because we had actually eliminated this virus in 1998. Like there were zero cases within the world, not even just Canada, within the world. Um, and so I was like, it was gone. And so I think, of course, COVID put us behind in terms of our vaccine schedules, and there's all of these barriers, but a lot of cases are popping up. And what's considered a lot, like I think right now, and the active cases of measles is 40, which you think of, you're like, what? Why are we even talking about that if only 40 people have it? Because the amount of people that had it before were zero. It was gone. So that's why it's important to talk about these things, because it's getting globally, it's like becoming an issue. So if you travel places and then come back to Canada, majority of people have like, if they haven't had a measles vaccination, and it's just super, super contagious. It's not a big deal necessarily, like if like you are someone that is immune, or you have like a great immune system, like you would get measles and that would really suck and you'd feel really crappy. and you would pass it on to other people, but probably you wouldn't die. That's not true of our elders and our abenojis or our babies or our infants or our children. It's definitely not the case. It's actually very dangerous for those groups of people. So the main symptoms of measles. So I mean, one of them in this picture you can see is like this rash. It's like this purple or red sort of splotches that like they usually start on your face and then they move downwards. So things that like symptoms, if you had measles, if someone had measles, their symptoms most likely would be fever, cough, runny nose, and red eyes, which you think of and you're like, well, every cold is those symptoms. You're like, do I have measles right now? I don't know. Honestly, I don't know. But a very distinguishing factor that's a bit different than other viruses, that's a bit more specific. It's not exclusive to measles, but it's a bit more specific is this rash. So something that, and it usually starts 3 or 4 days after, like you've had the fever, cough, runny nose, and then kind of like a little bit later in the week, you're like, what the heck? And it's like a rash you usually like can't ignore. So this is like another picture of like, it's not just like a random red splotch, like it's usually your whole body type of thing. Um, and so measles is super infectious and it spreads through the air and breathing. So, like me being in the same room right now with our two amazing nurses here, if I had measles, like fully they would have gotten it because it's anything, any type of particles that comes out of your mouth when you're breathing, when you're coughing, when you're talking, and not only that, it hangs out in rooms for like up to 2 hours. So say you were in your kindergarten, like, because I think of like kids and who are super germy and they cough and they touch everything and they're just full of germs. If one kid in a class had measles and there were multiple classes going through, every single class would have multiple cases because it continues to float around in the air for up to 2 hours. Um, Complications. So I mean, like at its best, people are getting a rash. They feel really crappy. They feel sick. At its worst, people get things like pneumonia, and even things like brain swelling. So the next slide is a bit more specific about like the bad things that can happen from measles. But 90% who aren't immune are likely to become infected. So that pretty much means if you're not immune, you will be infected. Like there's 10% of people who would be like, oh no, it's okay. You didn't get infected, even though you were around me who had measles. But majority would. And so that's why it's so drastic and why we're even talking about it is because it's just so contagious. It's a really um, good virus in the sense that viruses' jobs are to replicate itself and to recreate itself. So they're good viruses, not to us, but they themselves. And they spread often before you have symptoms. So another thing to consider, like this could happen, and you had already been around tons of people, and the virus, like it was already like you were already contagious. Yeah, so like I say, like at its best, getting an ear infection, diarrhea, eye issues, at its worst, pneumonia, swelling of the brain, which is called encephalitis. It's when there's an infection, and then it starts to make the brain swell. And because you have an orbit, you have like a skull bone here, your brain can only swell so far. And so when it does, it pushes parts of the brain against the skull. And then, yeah, people have seizures or like, because that part of the brain that's not supposed to be touching anything is pushed right up against the skull. And so these complications are more likely to happen in people who don't have a good immune system or have a weaker immune system. So, for example, like elders, people who have HIV, anyone who's like on any rheumatoid arthritis medications, like if you're on steroids, if you're on a biologic, right, your immune system is generally like not as great at responding to things. So yeah, we want to know about those things, like that this is the potential complication of not getting the vaccine. Majority of people are. It's often kids who are under the age of 12 that are kind of in this situation. There's some adults, but majority, like you've already been vaccinated, probably. Um, almost like almost 100% you have been. But no vaccine is 100%. But when you have um, 2 doses of a measles vaccine, it's nearly 100% effective. That's not true of any other type of vaccine because there's different types. So the measles vaccine um, is so it is the a weakened live part of the virus that's being injected, and so your body makes a little bit of an immune response, and so then that's how it becomes super effective versus giving a vaccine where it's not live, it's just like, I don't know, dead stuff floating around that they're injecting. And that's why you need multiple of them because, like, you need to get the flu vaccine every year. And that's because we're not giving live vaccines. There's only really a few in our context where there's live vaccines, but measles, mumps, and rubella is one of them. And why it's so good and so effective is because we're giving a live version and 2 doses, and then you're good. Like you're just set for life. That's it. You just be done, and you wouldn't have to think of it anymore. So if you were born before 1970, you would be considered immune, even if you didn't get the vaccine, because there was a huge mass outbreak in Canada. And it was actually just assumed that every single person in Canada was infected. Like, so they were just like across the board, they're like, nah, everyone got it. Everyone was infected for sure. There was such a mass outbreak. I don't really know, like, I wasn't born in the 1970s, so I'm not really sure what the context was like, but it was big. Everyone got it. So you're considered immune, even if you didn't get the vaccine. But nowadays, so this is like the publicly funded immunization schedule. It's different if you're in a different province. I just kind of screenshotted Ontario's to give you a sense of like how many types, like there's a lot of vaccines that are available. Why, like, and how often you would do them and what ages do you get them. So for measles, mumps, rubella, which I think is very dangerous, especially for babies that have no immune system, right? Because we can't give babies any live vaccines until like at least they're like past 8 months, because they're still trying to build their immune system. So babies get vaccines at 2, 4 months, 6 months, a year. Some people at 15 months, 18 months. Then there's like the pre-kindergarten stuff. And then after that, just kind of there's lots of other things. But the first dose of the measles vaccine is usually given when you're a year old. Like you're 1 year old, you're 12 months old, so you get your first dose. And then because if you get 2, you're kind of set for life. The second one is right before you go to school, so around age 4 to 6, and that's what people are referring to when they say like the preschool vaccines or like before you go to school vaccines. That's what they're referring to. And so yeah, this is the schedule, and there's a lot available. I think the measles one is quite important because of how contagious it is. All vaccines to me that I've and the evidence I've looked at are I think are important, but especially measles because it's just people get so sick. And so for live vaccines, I'm just going to go to this here. So for live vaccines, there's a small amount of bacteria, and it's weakened, so it's not able to transmit disease. For the like versus vaccines, like for example, what's one here? Like the pneumococcal C13. So that's not a live. So that's a not a live vaccine. It is something different. And so it's inactivated, right? So like we're not putting the live thing in there. So for sure you cannot get the illness. Like if you got pneumococcal MCC meningococcal vaccine, you got it, and then you're like, oh, and then I developed it afterwards. Like I got the disease, like I got the thing that it's not possible. It is possible for the live vaccines to have like a small number of like people who develop a mild form of the disease. So it's kind of like you're like, oh man, I just got vaccinated for like, I don't know, mumps. And then all of a sudden, like I developed it. And so I got a bit of a rash and I was sick and then I moved on. So it is possible. Um, and I think those experiences are important to share because you should know about them. It's very limited, few and far between. But for example, a kid who's given like the chickenpox vaccine, they might develop a few spots that look like chickenpox. Oftentimes, that's not contagious. It clears up quickly. It's a mild form of the disease. And great, you had an immune response. Now we really, really know that you're going to be immune to it, versus not getting the vaccine and just hoping that it's not going to, like cause serious illness because we don't know. We don't know. Um, so this is kind of a scientific, trying to break down vaccines and the types that are available. So like I was saying, there's kind of like you see this little virus guy, he's being he's like being weakened, he's being put under the water. And so it's like, okay, we're gonna make a very weak version of you. And then we're gonna give that vaccine to you because that's gonna give you protection. And then there's ones where it's like it's fully dead, like there's nothing. It's just we're trying to make the antibodies come out and be like, oh, what is this? Like, I see that there are some breakdown products of this virus that I have never encountered before. And so then it's like, well, I'm going to make antibodies, the things that, fight bacteria and viruses for you. I'm going to develop antibodies so that I can, if this comes along again, I will be ready. Like, I will not get sick from this. Our immune system is going to totally kick in. And there's so many different types. Um, so, but now something to think about, because it's like, I think when people think of live vaccines, they're like, oh my God. They're like, no. I've seen the hesitation in regards to it because it's like, well, you're giving a part of it to somebody. Natural viruses like measles on its own will reproduce thousands of times during an infection. Remember, a virus's job, its like sole purpose in life is to make more of itself. It's like, I am a virus. I want to do the best job a virus can do, and I'm going to make more of me. And I'm going to make sure I can infiltrate all parts of this body. And so viruses just like out in the world thousands of times. Like you get it and it's going to be like boom, 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 boom. I'm going to create more and more and more and more of myself. Versus a vaccine, we're giving a part of the liveness of it, but it's going to reproduce like fewer than 20 times. So it's kind of like, is it worth the in the wild, in nature, getting measles? If we're reproducing thousands of times, we're kind of taking a risk on like, hopefully no one dies and there's no complications. Versus just getting the thing and maybe you might end up where you're a little bit unwell, but it definitely was a lot less worse than a virus just reproducing thousands of times. So yeah, those are just some things to consider. There are people who shouldn't or like should talk to somebody before getting a vaccine, or like where it wouldn't be recommended. And particularly for measles, so people who are pregnant, right? Because there's this idea if it's a bit of a live vaccine, there's potential for that virus to go through the placenta, and we just don't know what could happen from that because we just don't know. So we're just like, I don't know what's going to happen to pregnant people. We don't know what's going to happen to the baby. So while they're developing, we don't know how this is going to affect development. So just like, no, don't do it. Infants under the age of 6 months, again, that's because we're building babies' immunities to like lots of other things in the meantime. Like we're giving them the tetanus and the polio vaccines. We're doing other things. We're working on other things. So we don't want to give babies just a live virus right at the get-go because they have no immune system. It's what they have, whatever their mom or their parent that birthed them, whatever antibodies and stuff they had, that's what the baby has, which isn't a lot, right? And then people with weakened immune systems. And that's not like, oh, if I have HIV, I can never get the MMR, the measles, mumps, rubella vaccine. It's just that, like, we would want to make sure the illness that you had been experiencing is well controlled before giving it. And those people, so these groups of people, rely on others to be vaccinated. And so this isn't true of all vaccines, but for there is such a concept that people have probably heard of. It's called like community immunity or herd immunity. So that's the idea of like, if enough people vaccinate, we should be fine. Like, hopefully nobody gets infected. And that was like something that was more common back in the 80s and the 90s. But the issue is that a lot of people are like, oh, it's fine. There's herd immunity, but we're vaccinating less. So there actually isn't a lot of herd immunity because people aren't vaccinating. Whereas if you said this in the 80s or 90s, that might have been true because a lot of people were. So anyways, that's just some tidbits and information. I think this connects to culturally how we think about certain populations, even in our own lineage and our own communities, right? So we always protected children and elders. Like, they were the center of our societies, and there were various levels of protection around them, right? Like, it was kind of like children and elders in the center because they are closest to Creator. They are very sacred, and on completely different ends of the life spectrum. And there would be protection around it, right? How can we make sure that our elders can age well, that they can return to the spirit world in a good way? And how can we make it so that our children grow up in a world that we want them to live in? And we always, all Native people, regardless of your nation, always thinking about what's best for the future generations. This was actually something that Dr. James Makokis, who's a really awesome Nahiawak physician, who at the time of like COVID vaccines was trying to tell people like, hey, it's like, we did this a long time. We continue to do this. We did this a long time ago. Like, if you're not doing the vaccine because you're like, I don't know, you just, it's not for you, just think about other people in our community. Like, I did not go and see my grandparents, and I didn't visit any single babies until I got all my COVID vaccines, because I'm like, there's no way I'm risking this. And I think we have that concept exists in our ideology naturally. Like, it already exists within our culture, this idea of protecting those who may not have that protection. So, how do you know if you've had the vaccine? Like I say, I think the date was like 1970. If you were born before then, you're immune. Everyone after that, if you're like, what? I don't know if I had the measles vaccine. There are ways to check. So probably the most for people who aren't as great with technology would just be to call the public health office. So for if you, in this bottom right hand corner, so there's the Ontario Public Health Unit locations. This is specific to Ontario. If you're in Manitoba, New Brunswick, just Google public health in your region, and they will have records of that. And you can say, hey, I want to know what my immunization records are, what was given, because I have no idea. The other option on this left-hand side, so you can actually access this online. It's through this Immunization Connect Ontario, which is sometimes easier for people. They're like, I'm not going to call the public health office. Like, just tell me, like, I want to just look, yes or no, did I get this? But you can have a copy mailed to you, faxed to you, printed. And I think it's just helpful to know because I don't know that it's like very commonplace for adults to talk to their children about the vaccines they got. Like, no one ever told me I got the measles, mumps, rubella vaccine. I assumed, I was like, oh, hopefully that's what I got. I did end up figuring out because I looked at my immunization records. The risks of the measles vaccines. So like any medication, like any vaccine, there is the potential for side effects and reactions. The most common, if you were to get the measles vaccine, is fever, stiffness, a rash. Some people might get joint pain, where you have that like achy body feeling. There could be some swelling in your neck or in your face because there's lots of lymph nodes in this area, right? And we're giving us a live virus. And so we are trying to get your lymph nodes working. That's actually great if that happens. Um, Interestingly, for measles, those side effects might not necessarily appear right away. It could like happen like up to a week after the vaccine. Those reactions are normal. They usually go away within a few days. For some people, they don't. Like one time I got a a vaccine and it just like was like boo, it just swelled up. Thankfully, it didn't go past here and it didn't go past here. So it was just like I just had a really good immune reaction, good for me. But there was a big bump and I was like, oh my gosh. Um, and it ended up going away. Like it was fine. So that you do have instances like that, right? Where you're like, well, there was this time. And so there's going to be a huge variety of how people react to vaccines because it depends on where their immune system was starting from. So clearly my immune system was like, we don't know what this is. This is completely new. Clearly you haven't been around enough like sick like enough of this, and so that's why I like got like a really big bump. I just put some ice on it, took some Tylenol, and then it went away. But we give this to babies, and you can take medications for like if you're having pain, if you're having fever, if you have that body ache, if there's some swelling, you can put ice on it. There is some evidence or some like controversy about whether putting ice on a place where you've gotten a vaccine is going to like reduce how well that vaccine works because right like we're trying to make inflammation in your body because that's how your immune system kicks in. It has to respond to something. So some people are like I don't know if you should put cold on it. It's fine. Just do whatever makes you feel. If that's what you need to feel comfortable with doing the vaccine, is knowing that you can put ice on right after to try and numb it. Go ahead. Just that's fine. I don't really know how much it would affect like the vaccine. I don't think very much because a lot of people do it. I did it. But it's just something to think about. Okay. I'm going to finish this last thing and then we'll take a break. Okay. So risk of allergy to a vaccine. Because a lot of people will say like, I can't have a vaccine. I'm allergic to it. And that is true in some cases. Often cases, that isn't. But it's possible. And so the knowing that it's possible to have an allergic reaction, which allergic reactions, that's like, all of a sudden you're like wheezy, it's hard to breathe, you might get some swelling in your face, your tongue and your throat starts to get really big, you might get some hives. People can have allergy and anaphylaxis, which is a very extreme version of an allergy that requires like medication, like you require an EpiPen or so like you require medical attention when you experience anaphylaxis. Which is why if you have an EpiPen and you give it to someone and you're like, oh, you're fine, you're good. No, go and get that checked out. It's not like a one and done thing. Also, people can get rebound where like the symptoms come back. But that's why most of the people giving you your vaccine, like your nurse or your healthcare provider, they're like, you have to sit here for 15 minutes. And you're like, I don't want to sit here. I'm done. Like, I already got the vaccine. I want to leave. I'm not like, please let me go. The reason why they do that, there's actually good reason. It's because if you are going to have anaphylaxis, which is the serious allergic reaction, like 98% of the time, it's going to happen in the first 15 minutes. So someone will be looking at you, monitoring you, and they can see if something's abnormal and treat it quickly, right? Versus like, you're like, I'm in a rush, I'm gonna go, and then you go in your car, and then that's when you develop anaphylaxis, right? When no one's around. So that's why people annoyingly make you sit there after your vaccine. So please just sit there because I don't want you to have if it's rare, but if it does happen, we just want to know and be there to be able to address it. Okay, so the next part of our slides, we're going to take a break right now. The next set of like what we're going to be talking about is just some, I think, common misconceptions about vaccines that I kind of want to debunk and give some information on. I'm going to be talking about like what I think as a physician, like what I, an Anishinaabe physician, what I think about vaccines and whether and also where you can access them because we actually in this sign here into the Mindemoya Health Clinic, there is actually a lot of places where you can be around Indigenous people, you yourself an Indigenous person, and access care and get vaccines that are done in a way that feels good and isn't as scary. And you get to be around our medicines, and you get to smell the smudge when you're getting a vaccine, right? Like to make this experience better. So that's what the next part of what we're going to be talking about is. But in the meantime, we're just going to take a break for about 10 minutes. Yep, 10 minutes. No, that's totally fine. 10 minutes is fine. The 10 minutes to please stand up and get some water, get maybe a snack. If you have questions, now is kind of a good time interval to type those in, and then I'll address them if there are any questions before we move on to the next segment. Okay. Okay, so see you in 10 minutes. Hey folks, welcome back. Hope you had a good break. So, so we received a question, and it's really great, and we're trying to actually find the answer in regards to this. But it's how long do vaccine records on the Ontario website go? Like, which is a great question because it actually depends on where you originally got your vaccine. So if you got immunized, like you went to a particular immunization clinic or you went to a place where it's well known and established that when someone gives you a vaccine, they're going to send it to public health so that your immunization records get updated. Because you can manually put in stuff now, but there was a time when vaccine records, they weren't like you couldn't look them up electronically. They were physically a yellow piece of paper. Some people still physically have that piece of paper, and that's like the main thing they use to track. So it really depends. So for sure, definitely goes back to like, the 80s. If where you got the vaccines was somewhere that was a part of a specific immunization clinic. If it was just some random place, then probably not. And so the way to go back for that, like say, I don't know, you lived, because it's not like all public health units like in every province talk to each other. So say you lived in BC, all of your like when you were a baby and when you were a kid vaccines were done in BC, and now you live in Ontario, those vaccines you got in BC won't be reflected on your Ontario. It's very specific to each province. So if you were trying to get a comprehensive look of like where did I get these, you'd have to individually contact those places, say like, hey, did I get this vaccine, yes or no, and then you would get that information and then you can upload it to the online portal of like, yeah, it says here that I didn't get it, but I actually did. It's from over here. But that's like the one thing that could definitely be changed and fixed about immunization records. It's nice that we can use this platform, the Icon platform, which is the online way to get your vaccines. But technically, it really depends on like if your first vaccines like were done on paper, if who submitted them, if they were part of public health immunization clinics. So that would is a bit of a process. Like anyone, like it's pretty easy for like a person that's 20 years old, like for sure we have all their vaccine records. Outside of that, it might not reflect everything, and so we'd have to go back individually. We'd have to go back to try and find that. Something to note that Kate towards the end will talk about is at the Mindemoya Clinic. If you are having troubles, like you're like, I want to get all of the vaccine records together, but it's logistically a barrier, you're like, there are actually people here who can help navigate. So we have people who help navigate systems. So that's one of the things that they can help you with is if you're trying to figure out, like, did I get this vaccine? Where would I have gotten it? All of those, like we have people, medically trained people who can help you navigate that and help support you to get your immunization records, or to create an online portal or whatever it is you need help with in regards to this. We want to support people in terms of like what they need in order to feel like they are informed. So I think that was the only question, right? Okay. So the next part of what we're talking about, which are, yeah, I guess like the things you hear in the news where you're like, I'm not getting it. So do vaccines cause autism? No. So there's this thought that, and there are these sort of studies where people made this correlation and this assumption when there were other things that could have caused it. So the thing that people think when people are like, oh, vaccines cause autism, which what they're referring to is this particular ingredient, the thimerosal, which is like a type of it's a derivative of mercury. So people are like, you're giving mercury to the children, and so now they're developing autism. And that particular version, it is not actually dangerous. Like it's a version of mercury, but it's something that once it's in your body, it's metabolized very quickly to ethyl mercury, which is totally fine. Um, and so the form of mercury that causes like serious brain and nerve damage is methyl mercury. right? So when people are like, when they get mercury poisoning, like I think of like my patients that are from Grassy Narrows or Treaty 3 area, you know, where there's mercury poisoning because of industry, and like their nerves are like messed up and their brains like it's hard to think and concentrate, all of these things. Mercury poisoning, the actual formulation of mercury is methylmercury. What this ingredient, this like derivative, which is not even actually mercury, it's a derivative of it, as soon as it enters your body, it breaks down to ethyl mercury. And your body gets rid of that and pretty quickly. So it's hard to accumulate. Whereas methyl mercury, that's why, like, you know, people are like, when there's mercury poisoning in an area, you know how sometimes people say like avoid eating the fish, or like because it has the potential to accumulate. It doesn't just leave your body quickly. It actually takes a very long time. And so there's this like you're getting more and more and more. And so, and then, yeah, when you do have high levels of methyl mercury, I don't know that it causes autism, but for sure it causes nerve damage and brain damage. But that's not actually the mercury. That is a preservative, because it's a preservative. It's not even the thing that's helping create an immune response. It's just to keep the vaccine stable. It's a preservative, this thing right here. So, and your body breaks it down very quickly. And it's very effective, and it's not going to accumulate. And also, you're not going to be causing autism. To date, there have been dozens of studies, like examining millions of children, that have failed to find any credible association between vaccine and autism. Right now, we know very little about the specific causes of autism. So there's a lot of things where I'm like, I don't know what the cause of this is. So theoretically, could it be a vaccine? Yes. Theoretically, could it also be because we eat McDonald's? Yes. Theoretically, is it because of the sun and like the exposure we have to pollution? Yes. Like theoretically, I have no idea. But we haven't been able to make that direct correlation. And so I really, um, it's, you know, it's not true. It's not true. Vaccines don't cause autism. Do a multi there and nobody knows what causes autism, but vaccines, they've done that. They were like, I'm going to give you this vaccine, and based off of like did this child develop autism after they developed the vaccine? And what they found was that the natural level of people who are going to be born that are going to develop autism, it was the same number. So like the amount of people who got the vaccine, like, so it's not like the all kids who were vaccinated, they and the ones where there was like, oh, well, they did develop autism. Like statistically, without the vaccine, that would have been the case anyways. So then it's kind of like, well, how would the vaccine affect the numbers if it's the exact same numbers that would just occur by chance, like us not vaccinating at all and everyone just living their life and people who develop autism. So that's something to consider. Early warning signs of autism, I think autism is actually quite common, especially in our communities. So early warning signs, if you are concerned about autism, usually there's like lots of sensory issues. So light, sound, there's this sense of like being overstimulated quickly, and that's because a certain part of your brain is affected. Sometimes that can look like children wanting to play alone, like they feel isolated, they kind of want to keep to themselves. There's some like movements that kids have. And so it's not to say like, oh, that's autism, but there's a spectrum, right? So like there's people with autism and they're like very highly, like they're functional. They like it like almost doesn't affect any of their function in their day to day. And then there's people with autism where it's like it affects everything. It's actually very hard to live. It's a disability. So there's a wide spectrum. Those are some of the symptoms, something to look out for. But like it's just vaccines, autism, that I don't know. It doesn't. It's really not. Those two things, we can't correlate them, because there's too many other factors that could be that could be contributing to this. The next thing, oops. Aren't there salts in some vaccines? Isn't that toxic? I don't know why that copy and pasted twice, but some people will be like, I'm not getting vaccines because there's aluminum salts. Aluminum salts actually aren't contagious. A lot of vaccines, you know, they might contain aluminum salts, and that's essentially to like, again, help keep the vaccine stable, right? Because they're in bottles, we have to keep them stable. But the amount of aluminum that is in a vaccine is less than 1 milligram per dose. So if you think about that, when you take an antacid, like for acid reflux, when you're like, oh my, there's burning, and you take an antacid, you absorb a significantly higher amount of aluminum salts by taking a Tums than you did by the vaccine. So there are aluminum salts, they are not toxic, and also they come in such a small amount, like it would be very unlikely and very difficult to develop toxicity from it, given how small the amount is. And also, like, getting side, like, for the most part, people take a Tums or they take an antacid and they're not having really severe side effects, or thinking they developed a cancer because they took an antacid. So there's not really a correlation there, which I think is important. It's to help put these things into context. So, like, do vaccines cause autism? No. Like salts in vaccines, is that toxic? And so it's just to help reframe things, so that you can decide if, like, the potential risk of 1 milligram of aluminum salt that is less than what you would receive in a Tums, if that risk, which it might be where that risk, you're like, nope, can't, like, that's not the risk of that is not worth the benefit of a vaccine. And that's fully within your right to make that decision, to be given all the information and then to make that decision. But just to help put it into perspective. Sometimes people think, like, oh, should I just wait to, like, I'll just wait to be infected. Like, it's fine. I don't need to vaccinate. I'll just, wait. Probably I'll get it and then I'll be immune, right? And that's true. When people catch infections, like, you develop better immunity than you would if you got a vaccine. And that's because you're getting the whole live virus all in one dose, right? Versus like the virus is, yes, of course, you're gonna actually have really great immunity for that particular virus, because you got, like, the raw source of it, versus the vaccine, which gave us the weakened source of it, or the vaccine that, like, didn't even give us the source of it. It just gave us a byproduct of what was in it to try and get our immune system going, right? But relying on natural protection, I think just considerably greater risk than vaccines and reactions than, like, you just kind of, trying to figure it out. So there's more serious complications, right? When you just have the virus versus having a vaccine and then getting the virus. So the seriousness of that is less common. People who've had the vaccines. As well, some diseases can be caused by different strains. Like, we think of, like, COVID, for example, right? There were multiple strains. And so when a disease is caught, only that single type of strain is caught, which is why there were so many people who were like, I'm tired of vaccinating for COVID. Like, and it's because it's an excellent virus. It reproduced itself, and it was like, oh, like, they're trying to vaccinate against me. I'm going to pivot and I'm going to make myself even better so that I can reproduce myself because I'm an excellent virus. Yeah. So you're only, like, if you got COVID and you're like, oh, I'm immune. Yeah, to the strain that you got, but there's so many other strains, right? Because viruses are super smart. They're, like, so intelligent. They can just adapt. And so natural protection is only valid for that particular strain. So this is sort of this idea of, like, yeah, you could just wait to be infected. Kind of sucks for, like, children, babies, elders who are, like, kind of, their immune systems are depending on us to have, like, to not pass on infection, and to pass on viruses. But yeah, you will get better immune response if you just full on got the vaccination, or full on got the virus, I should say. But it's like you're taking on the risk of fully getting that versus the potential risk. Like, we know there are risks when people get COVID. We know, like, there are symptoms. Versus getting the vaccine, there might not necessarily be those symptoms. Okay, so this is sometimes common. So, like, when people are hesitant for their babies, and they say, I don't want to overwhelm or exhaust my baby's immune system, like, we can't. Sometimes people are behind in their vaccine schedules and babies get, like, 5 needles. There's no limit to like how many vaccine needles you can get, but it's not necessarily a concept that you can overwhelm or exhaust a baby's immune system, because your baby's immune system can react to 10,000 different microbes simultaneously. Like your baby just sitting there is like 10,000 microbes, like viruses and stuff, could be like trying to get into you to overwhelm your baby's system. And it's able to recognize thousands, even millions of different microbes and react to them with no problem. So if a child receives vaccines, and there's the weakened components of the virus, that's a lot less than them just kind of I don't want to say, but like raw dogging life essentially, like to the 10,000 different microbes that are just in the world. Like we're giving them such a smaller portion. So for example, in 1980, the 4 vaccines in the regular immunization schedule contained 3,041 weakened microbes or parts of the microbe, right? We're like taking little parts of the virus to help protect us. And in 2000, so like 20 years later, the 11 vaccines that we have that are pretty much like the schedule we have contain a total of 126 microbiomes when babies can respond to 10,000 different microbes. So it's okay. We're not going to overwhelm or exhaust the baby's immune system. We are going to help assist the baby's immune system. And relative to other things, it's like they are exposed to way worse. Just, eating from their like little trays and picking up and touching things, like they get way worse. So we might as well give them the thing that's actually going to give some immunity to something. And so we don't need to, so you don't need to space out people's shots is what I'm saying. When you're like sort of behind, there's this idea where it's like, oh, we'll give one and then we'll come back and we'll give one and come back. Babies are traumatized. Like they know when they come into the clinic, like what's going to be happening. So it's actually very nice if we can just bam, 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 get it all done so that like they aren't associating being in a clinical setting with someone sticking a needle in them, right? So if we have less exposure to that, because we just get it done all in one shot, it saves time for you. It's less trauma. You don't have to see your baby cry. We'll just get it all done at once. And like, it's not going to be overwhelmed. Your baby is going to be totally fine. And in fact, like younger babies are at a far greater risk of being hospitalized, and the risk of death from preventable diseases. And so delaying vaccines actually can sometimes put kids in danger because it's like we're putting them in the world. Maybe they're behind, they haven't gotten their polio shot. And because we're like, oh, like we want to wait for another, couple weeks. And then it's like, well, then the person was exposed. So that's that many months or weeks that person didn't have that immunity. So think of it the opposite. Like we are helping babies' immune systems by giving them the vaccines, and we don't overwhelm or exhaust them, and we don't need to space out vaccines. Like if you're behind, otherwise there's a regular 2, 4, 6, like the schedule I showed you. There is a schedule and we can follow it, but it's not. Some people critique that our immunization schedule is quite rigorous, like it's just very intense. When I'm like, actually, it could be more intense. It could be like this could be better. It's a good interval of when to get things. Okay. Do vaccines actually prevent illness? Because there's this idea that they don't. And so and as this sort of like text outlines, there's not much in this world that offers 100% certainty, and vaccines are no exception. The protection vaccines can offer is pretty darn impressive, especially when we think of the measles, mumps, rubella. Most routine childhood vaccines are 85 to 95% effective. And so that translates to it being worth it. Like that's a high percentage. If a vaccinated kid does have a breakthrough infection, because it does, I'm not like denying that happens. That's totally sometimes the case. Kids get vaccines and then they get a mild version, like immediately after getting the vaccine. Yeah, that does happen. And we have to weigh the risk of that versus the benefit of the vaccine. The symptoms are often more milder, but it's still a possibility. For sure, we don't want like, it says, thanks to immunization, most children will never experience meningitis, polio, tetanus, or whooping cough. we want to keep it that way because those things when they were rampant in society like did kill a lot of children. So especially these things, we really want to keep on top of. Like if you're gonna pick and choose a vaccine, pick the measles, mumps, rubella, and the meningitis and the polio, because those are things like that's very, very bad. When I see kids with that, I'm like, oh my, this is not good. Like I am like, I don't, it's not good medically. Um, it's just not good. So, as a Native family doctor, working in my community, so I work actually, so I locum, so that means that I go to different clinics to help, like when things are overwhelmed or like people need a break, their providers need a break, and so I help take over. So, majority of my work that I do presently is at Wasagijikanondawegamig, which is known as WinHAC. It's a community health access center that actually services one of the reserves that I'm from. I'm a band member of Whitefish Bay. I'm originally from Rocky Bay First Nation, but my family we changed our band membership when we were little because that's where my brothers are from. So I'm a Whitefish Bay member, but originally from Rocky Bay First Nation. But I get to help people that are in my actual community. Like there are people from my res, and I see them, and I say, "Great! Like it's so awesome that I get to work in my community." Um, and I think we want to be able to have when people are sick options, right? Both Western and traditional medicine. Like in my traditional medicine camp, I learned about protection things and protection tinctures and teas that our traditional medicine people knew that were like to prevent COVID. And they were like, this tea, taking this, building your immunity with this. I think, it has just as much value as getting a vaccine. Like, I don't think you need to pick and choose. I want both personally. I want access to both of the best of both worlds. But we have medicines that definitely like can help with COVID and help build your immune system. And so I think it would be great for people to talk to traditional. I personally like can't give out that information also because like I'm not experienced enough to be able to speak confidently on this. But I just know of medicines that we use to prevent things all the time or treat cancers or all of there's multiple things available to us, and so just take what you want, take what you need, but you should have both. I should have access to both. Sorry, you don't have you pick and choose whatever you'd like. But culturally safe care. So it's really important. This is more for care providers, if there are care providers that are watching, not necessarily patients, or also patients. But what is culturally safe care? So building trust with Indigenous patients. So we need to build rapport. We need to build trust in systems where there is a lot of mistrust, and we need to make it better. For me, myself, like I always think about how people's social economic conditions and their history inform their medical illness, that it informs how they show up to the clinic, to the hospital, to the emergency department. We always have to think about that in the back of our mind, communicating respect for patients' belief, behaviors, and values. So if an elder comes up to me and they look me dead in the face and they're like, there's no, way that I'm getting this vaccine. Like, don't you dare even ask me. I'd be like, okay. Do you feel like you have all the information you need? Yep. All right, then that's the end of topic, right? We shouldn't shame people for like thinking one way or the other. Because if people are informed, they know the risks and they weigh the benefits, perfect. Your right as a Native person or as a person is self-determination. So make the choices that you think are best for you and your family. But we want you to be a part of the decision making. So in Des Moines Clinic, that's a big part of it, right? Like this is your body. What do you want? How do you want it? And so we can help that. And you should know that you are an equal partner in decision making, even the times that it might not feel that way. Know that you have a right to assert the fact that you have equal decision making power as the person that's sitting across from you. So I think probably throughout the presentation, you probably got the sense that I see immense value in vaccines. I have seen the ramifications and like the rare one-off allergies from vaccines. And I also, have a background and know exactly what's happened to our people in regards to vaccine experimentation, like to create certain vaccines in this world that are really like helpful and life-saving, like our people were used for some of those things. So those things exist. I recognize those things as someone who can see from both worlds. Like I have access to the Western ways of thinking, Western medicine, Western understanding of disease, and our traditional practices. I see immense value in vaccines. I do worry when people don't want to get them. Like I want people to get them, and I worry when people don't. Like it actually, like I don't express that necessarily. I'm not like I'm so worried. Sometimes if someone's like truly, I'm like no no no, please get this vaccine. Like I will I will beg, I will ask because I'm like I really want you to get this. And so most of my patients know, like they trust that the recommendation I'm going to give them is like from a good place. Because how I gauge and trust something for our communities, which I am a part of, it's based on evidence. One, that my brain has been conditioned to look through all the randomized control trials and read the biases and all of this stuff. So I looked at all the nutso numbers and like evidence and like and so being able to read that, articulate that, know about that, and then decide, is this something I would give to my own family? That's honestly how, when people are like, oh, what should I do? I'm like, well, if you were my sister, if you were my Mashomis, if you were my grandpa, if you were my Kukum, you were my grandma, this is what I would tell you to do. Like this is if that's who you were. And so vaccines are 100% things that I recommend. My family is of the utmost importance to me. It's why I do this work. It's well, it's everything. My family unit, and all my siblings and cousins and grandparents and aunts and uncles. And I was like, I think you should really get the vaccine. Both sets of my grandparents did. And that's because I trusted that that was going to be safe for them and I wanted that from them. And they trusted, they were able to trust that I was looking for their best interests, knew the history of where we were coming from, and still make a recommendation. So my recommendation to you as an Anishinaabe physician is to get vaccinated. I support you even if you don't. Your healthcare is not going to be affected. You will not face discrimination if you choose not to, because that is fully within your right. Which brings us to sort of like the last conversation bits, which is about Indigenous health legislation. So this is a busy photo, but it's kind of what healthcare should look like for us. So we kind of went over this. So treated and respected as equals, respectful. This is a new day. We need sovereignty, the right to self-determination. There's critical health needs, like specific areas where our people specifically are struggling. We also, when people are doing research or they're doing vaccines or they're doing stuff with us or to us, that is our information. We get to decide what to do with that. We want holistic health. We want to be able to address all of the four components of the vaccines and all components of the medicine wheel. I always like think about like people's health in terms of that, and I think of vaccines as part of people's physical health. And so that I'm sorry for like what the state of our medical system. It is really not great to navigate, and there's a lot of work that still needs to be done in our own health legislation. So, like having access to medication, like there's still so much that needs to be changed. It is going to be changed. There are people in medicine, Indigenous people in medicine, who specifically went into medicine with this goal of like, how can we change systems to make things better? So this is a part of that. This is so She Is Wise. So ONWA, Ontario Native Women's Association, every I think like bi-yearly, they release the She Is Wise magazine. And so the most recent one, I believe, was actually a story and article that includes the two people that are sitting here with me today. And it was about changing healthcare systems. So they initially, like how this clinic even came to be, is that well, first of all, so many people, Native people, were dying from COVID. Not a lot of people were getting the COVID vaccine for lots of different reasons. And so like Anwa and this healthcare team that is full of Indigenous nurses, like primary care providers, all of this stuff came together and like we have to make this better because our people are like we're paying the consequences of not getting this, and we need to bridge that gap, and so they did. So that's how they created this clinic. So vaccines are actually available specifically for people in Thunder Bay. Other public health offices like have access to this, and probably in your area, you might already know of like a native health access type place where you could get access to these things. But public health for sure, you don't need to be a patient to get those done. And that's true of the clinic here. So I believe the clinic here offers the COVID vaccine, flu vaccine, and the measles, mumps, rubella. So the one that I've been like talking about this entire time is actually available here. And it's, you know, like that generally the premise of vaccines is like it doesn't matter if you have a doctor or not, you have access to them, and that's true for that case here. But there are ways that people are bridging this to make this better. So I found this. So this is an example of some of the resources or information that has been produced by Onwa, talking about like why do vaccines matter? Because it's important. Like, what do our people think about getting vaccines? So these are kind of like little memes to help us think about vaccines in a cultural context. So some people are getting their vaccines generally because they want ceremonies for their mental health and cultural health. Like someone is who's an elder is there, they might be immunocompromised. You're getting vaccinated maybe because you want to go to that ceremony and you want to be able to access cultural health and not be worried that you're going to give this elder some life limiting disease. For some people, like especially during COVID, so getting vaccinated because you want to get back to the powwow trail. This was more true. So these were like more specific to the COVID vaccine because that's the thing that they were working on. That vaccinated thousands of Indigenous people because of how successful their program was. So this was more like, you know, we're not, this was more like in the height of the pandemic, but it's sort of the same concept and principle of like, there are cultural reasons why getting a vaccine is important. And something to know about, like what to expect at a vaccine appointment. If you haven't gone before, like what should you do, whether it's a child, youth, family member, or yourself, like what are things to know during, before, after getting your vaccine? So this is just like a picture of some medicines because I know here at our clinic that that's what we have access to. When I went and got, I can't even remember what COVID vaccine it was. But when I came, because I brought me and my husband, I was like, we're getting our vaccines here. Way better. Just because there was like, you walk in, you could see all of the medicines, there was water handy, there was like a place like for playing. The room was set up very comfortably. It didn't feel very like medical. At the end, I think you get like a juice box and snacks. And I'm not sure if that's still true, that is still true of the case. I'm like advertising something that we don't do anymore. We do apparently. But it was the greatest experience. And I got to like talk through, like when I had a question, it was like, yeah, we have time to talk about it. It's not like boom, boom, in and out, like, thank you, good job, bye. It's actually a wholesome experience. And so vaccines can be nice experiences where your whole family gets to go and there's places for kids to play and to interact and you can ask questions. You could do things as a family and be around our medicines. That is a possibility. There are a lot of places that do that, and Des Moines Clinic is one of them. So before your vaccine, best to bring and have your health card ready because that's the thing that we use. Like, you know, that online portal that I was talking about, in order for us to say like, hey, you did get that vaccine, we're going to send it to the online database. We need the health card. And so it's okay if it's expired. Don't let that delay you from getting vaccines. Like you can just get them. It's fine. We do want to update your health card. That would be good, but like don't delay because of that. So wearing loose or short sleeves that can be rolled up easily. That way people have access. Like if you're wearing a onesie or something and then you're trying to access your arm, right? You want to just something that's easy access. And then for babies, when I think about them getting vaccines, it's nice if it's a onesie where you can access their legs or their arms easily and for them to still be comfortable. So just think about what you're wearing before you go to a vaccine appointment. During the vaccines, this is like because there's a lot of like kids, you know, don't really like getting most people don't like getting needles, but especially kids. And so the way to improve vaccination experiences is comfort, asking, relaxing, distracting. And so when we are able, so it's not ideal to negotiate with the child about whether they get the vaccine or not. Like to be like, if you get this vaccine, you're getting McDonald's. If that's what you need to do, that's fine. But a big part of it is like comforting, and talking through like children when they are about to get the vaccine, and even holding like adults or baby, right? When someone's being held, they're being held, their endorphins, dopamine is being released. Dopamine helps decrease levels of pain, right? So when there's access to feeling and touch, and you're able to communicate, and you're able to like react to you're able to respond to a child's emotions, because they might cry, they might be upset, and you're able to stay calm and at ease, right? If your kid's flipping out because they're like, I want this needle, they're screaming, running around, you responding with a similar energy of like, well, we're doing this, and holding them down is like not ideal. But there are lots of tips and tricks, and most of the people giving you the vaccines know that, on how to just make it better, like to make it less painful. But the key is like you having knowing that you might be like upset, like you might, it's sad, most parents don't like seeing their kids crying because of a needle, but having that soothing voice, that soothing touch, a favorite toy, story, song, keeping your child busy with like a game or a video or the phone, those are all important things. And most babies will not remember this. Some children, they're like, they know when they're coming to a clinic that they're getting a needle. But again, the I don't know that a child's discomfort, because a child's discomfort of like, I don't like needles, so I'm not going to get them. Maybe for you, that is enough to outweigh the risk of not getting a vaccine. But for most people, it's like, no, we're going to do the thing. Like you'll be okay. We'll survive. So just use that information how you will. But touch is specifically something that releases dopamine that helps with pain. Okay, after the appointment, it's normal, especially, I mean, this is probably true of adults too, not just babies and children. Being fussy, that's true for me. Having a bit of a fever, more sleepier than usual, having pain, swelling, redness where the injection was. Again, these are all normal. I honestly think it's a good thing. I actually think it's great when people are like, oh, I got this vaccine and then I felt like so sleepy and I had a bit of a fever. I'm like, great. You had a great immune response to that vaccine. I'm so happy. You don't like that. You probably don't, but it's nice because I'm like, wow, I really know that you had a good immune response. Like this vaccine really worked. So yeah, when you tell your healthcare provider that, I'm like, good job. We don't want those things, but it happens and it's a good sign. It's not a bad sign. It's actually a good sign. And if you need advice, because kids, Tylenol and Advil is dosed based off of their weight. So if you need help with that, there's like tools online, and also Mindemoya Clinic can help you with like trying to figure out a dose. Some people will give their kids like Tylenol, children's Tylenol right before they go. It's fine. You can do that. There is some evidence in, I think it was from the emergency department in Vancouver, that like giving kids sugar was just as effective for pain relief as giving Tylenol. This is true only for babies. So that's something to consider, is like, I don't know, just give your kid something sweet maybe. But that's what to expect. So what we went over today was vaccines, the harm that like vaccines specifically have, like the harms that have been perpetuated towards our people, how we're navigating them, how we're adapting them, what vaccines are, the types of vaccines there are, what to expect when you're getting a vaccine, the risks, and also putting into perspective the benefits, right? The risk of what you think something is a risk relative to something else, right? So having those side by side examples of like, oh, 1 milligram of aluminum salt versus 5 milligrams in the Tums. It's so helpful to put those things into context. And when you are looking at sources, I do encourage looking at sources that are from credible medical sources. It's important to like figure out, is there industry bias? So that's like, Pfizer, one of the people who makes the vaccine. If the studies about their own vaccine were their own people, right? Then you assume, okay, there could be some bias here, but look at things with a critical eye and don't just believe immediately. Like let people explain to you why they think the things that they do, and also just ask your providers, ask people in healthcare, like ask trusted medical sources. Okay, so I think that is everything. I just want to make sure. Okay, so we have some questions. Okay. Question one, is chickenpox a form of measles? But when we talk about measles, it is a different form of virus, one that is more serious, correct? Yes. So chickenpox is different than measles. They are both childhood illnesses, like they mostly affect kids when they're younger. So that part of them is similar, but they are different. And measles is a lot, well, I shouldn't say more dangerous than chickenpox because they're both equally as dangerous to little babies and elders. Um, like when someone's not immune to them already. So I'd say chickenpox is kind of like we think it's a little bit less harmless because people used to have chickenpox parties, right? Like you'd be like, oh, your kids have chickenpox. And so you'd go there and then get each other all infected and survive, right? So chickenpox for sure, like there maybe are less potential harms than measles. But I'd say like they're both equally as serious. Why are there different stages at which, why are there different life stages at which children and adults get vaccines? Great question. So scientists and research spent a lot of time trying to figure out what is the right interval and what can we give. So it, so the reason why there's different life stages is because people researched when would this be most effective. For example, when like people grade 6, 7, and 8, right? Getting an HPV, a human papillomavirus vaccine, which is something that can be HPV can be transmitted sexually. It makes sense at that life stage to give it around then because there's potential for people to be sexually active around that age. Whether you think that's too young or not is like your own business, but that's around the time versus right. Like if we gave it when a kid was 2, that's just not the things that they would be doing in their life. So one is like based off of the activity that they're going to be doing. Like kids are going to be touching a bunch of dirty stuff and getting germy. So we want to like front load a lot of their vaccines, right? So that they can do that, be free, touch all the things, and also not become super unwell and have a good immune system. And it's also just how long those things last, right? Like after a certain amount of time, like for example, your tetanus shot, if you've ever like, I don't know, got cut, you stepped on a nail, got cut by like some metal, you're like, oh, that could be really dirty. Tetanus is actually, it's for your neck if that happens again. Tetanus in the moment, a tetanus vaccine won't prevent tetanus if you already have it. There is immunoglobulin. That's where if you're like, oh my gosh, I am quite sure I got tetanus. You wouldn't give the vaccine, you'd give the immunoglobulin, which is the thing to help treat it. But when people are saying like, hey, is your tetanus up to date? Like after 10 years, there's just not as much protection because that's how long that was the shelf life of the vaccine itself. So some of it is how it's produced, some of it is their life stage, but I think that's such a great question. Um, I've heard that the more serious a reaction to the vaccine, the worse a case of the virus one would get if the person got stick without a vaccine. Is that okay? I've heard that the more serious a reaction to the vaccine, the worse a case of the virus. So it'd actually probably be the opposite. So I think the more serious someone has had, the more like if there were serious reactions to a vaccine, they got even better immunity than you and I because they actually got a form of the raw source of it, or it transitioned into the raw source of it. The worse a vaccine one would get if the person got stuck without a vaccine. Can someone help me interpret that question? Does it say?
This one here.
Yeah, I think I answered it. I hope I answered it. Can someone, whoever asked the question, tell me if I answered it or if there's a, maybe I
Like, I'm wondering if it means I've heard that the more serious a reaction to the vaccine, the worse case the virus would be if they hadn't got, like, I'm wondering if what they mean is that if they got if they had a serious reaction to the vaccine,
Mhm.
that means that it would have been just even more serious if they hadn't gotten the vaccine.
Exactly. Yes,
Yeah.
that is for sure.
Thank you for.
Thank you. Thank you.
You're gonna
Yeah.
put that person
So
in
if
black.
like if you got the vaccine and then you ended up getting the infection and it was already really bad, like probably the thing would have been like even worse. Like it would have been even worse because you already had some immunity. So if you had none, the ramifications would have been way, way worse. That's for sure true. Thank you. That is exactly I'm pretty sure um what was meant. Okay. Did I miss anything else? These were excellent questions. Thank you so much for asking them. Okay, so I think that's everything. So that's all I have in terms of information. Thank you for sticking it out. This is like probably a very boring talk. But thank you for watching and for listening and hopefully learning. If you have other questions, please like get a hold of our clinic and we can help you now, especially if there were things where you're like, oh, I want to know how to do that or I want that vaccine, please get a hold of us. But otherwise, I'm going to pass it over to Carly.
Sorry, I was really quick there.
Yeah, it's okay.
Taking the mute off. So sorry. Hopefully everybody can hear me right now. Thank you so much, Alexa. I really do also appreciate all those questions that people had submitted. Thank you so much. If you're thinking something, I really appreciate when you don't hesitate and you ask because I'm 100% sure that there's many other people who have the same question as you. And there's just so many things to talk about with vaccines, so much information to share. And there was a few things that came up for Kate and I that when Alexa was talking that we were like, hey, we're gonna write this down and we're gonna bring this up at the end. And one was the idea about the trying to locate your immunization record. There are so many different scenarios that could happen. And so it's really hard to say generally that you should be able to find your record all the way back to when you were born. There are sometimes people, like professionals, are inputting that information. They're typing in records from that little yellow card. But then there's right at the point of care where you get your vaccine, that nurse could be inputting that vaccine right there on that very day in that moment. So what we would like to say right now is just to put up our number for the Mid-Des-Moines Health Clinic in Thunder Bay, that if anybody has any questions, that they would like some help finding out what their immunization status might be, we would love to be there for you and help you figure that out. Also while Alexa was talking, I was just trying to go into my immunization record online, and there was a lot of steps. There was a few times that I had to just input all the same information again. So please feel free to give us a call here, and we can help you sort that out. Kate had also mentioned too, just like a little whisper, that if you do ever feel like that there's things that are making you hesitate to call a health clinic or go in to see about your immunization status, like if your health card is expired, that would be another thing that we would love to help you figure out and get that up to date. I'm wondering if there's anything I've missed. Anything I would love to also just mention the survey right now. I'm going to ask our coworkers in the background if they can just post a link to that survey right now. For those of you who are still with us, we would love to hear what your thoughts and any questions or any feedback you have for us around how you felt today went. Is there anything else I'm forgetting right now?
Well, I was just going to say that if anybody post this health talk has any questions about the vaccines, just give our clinic a call. One of the nurses can chat with you, or we have a health navigator who can help you find resources that you might be having trouble getting. Yeah, just give our clinic a call. Our phone number is 807-697-1753. And we're here from 9 a.m. until 4:30. And then we take lunch from noon to 1. So if at all you have any questions, just give us a call. And like Alexis said, we do have the MMR vaccine. So if you're due for it, feel free to come on down to the Mindemoyan Health Clinic. We try really hard to be culturally safe and a calm place for people to come. If you come and you don't feel up to it in the moment, that's okay. You can leave. You could come back. You could come back 100 times if you need to. We really try to make it a pleasant experience. So yeah,
And supportive. And
Yeah.
Yeah. And we appreciate you allowing us to try to help you reach those goals. Sorry.
that's okay.
So I'm just hoping that the survey has been posted in there. Thank you so much. And again, thank you to everybody who joined us today. We really appreciate that. And we look forward to seeing you all next month. I have forgotten right now what our next month's talk is in June. My apologies. But we will have that posted. So please have a look at our Onwa social media, and we will have another poster up there shortly.
Sounds good.
Take care, everybody. Have a great night.
Bye.
Bye.
Creator, Wabadum, Shaw.